everyone. Thanks for coming today. If you can't hear me, give me a wave and I'll talk louder and clearer and closer to the mic. So I'm Tracy Grongold, this is me. I am a registered psychiatric nurse, also community mental health nurse. Brianna and I both work out of the Community Health Center at Market Mall, and I think most people are familiar with that clinic. I've been nursing for 35 years. I've spent most of that in mental health, also working with seniors. I've been in this position at the health center for the last 3 years. And I'll let Brianna introduce herself.
Hello, thank you for the delicious meal. It was very good. I'm Brianna, and I am also a registered psychiatric nurse. As Tracy said, we are both community mental health nurses. We work out of the clinic at Market Mall. I've been there about a year. In June, it'll be a year that I've had the pleasure of working with Tracy. And prior to that, I worked at RUH in the Dubé Center for Mental Health.
We're both going to go back and forth between slides, so we're going to be passing the mic back and forth. So, what is a CMHN? Community Mental Health Nurse. So, some of the things that we do is this your part? Okay. So, some of the things that we do is provide emotional support for clients. We also provide education around mental health medications. Some of that includes anxiety and depression, and understanding and coping with a mental health diagnosis. So we offer short-term, kind of individualized treatment plans. And that all depends on kind of what's happening in your life. So the criteria that we have at the clinic for our program is very minimal. When we developed the clinic, we wanted people to be able to access services without any barriers. So the only really prerequisite is that you have to be over 50 years old to access the clinic.
So some examples of the mental health diagnoses that we work with are dementia, depression, anxiety. These are the three most common that we see in seniors, and the majority of our clients have one of those three. We also see a variety of other illnesses as well, such as PTSD, so post-traumatic stress disorder, personality disorders, mood disorders like schizophrenia and bipolar. And we will, throughout the presentation, we're going to get into a little bit more specifically about dementia, depression, and anxiety, just because, like I said, those are three of the more common ones that we see.
Okay. So we'll touch on dementia. So what is it? Dementia is something that affects memory, thinking, and the ability to perform daily activities. Your family doctor can assist you with if you're having any memory concerns for you or your loved ones. Memory difficulties can cause other mental health concerns like anxiety. And we just want you guys to know that there is support. We have brought some pamphlets and stuff from like the Alzheimer's Society. And so there's lots of supports out there that are available. So some memory difficulties are a normal part of aging, and we do get asked that. I got asked that once already since you've been here. What's the difference between normal aging and the onsets of dementia? So that is definitely something that you would want to talk to your family doctor about. I mean, we can at the clinic help with those kinds of things, but your family doctor is always your first line when you're having these kind of struggles, to talk to your family physician first of all.
We also forgot to say, if there's any questions throughout, just raise your hand or shout them out to us. You don't have to wait till the end. So questions, discussions, those are very much encouraged. So now a little bit about depression. So what is depression? It is a condition that causes persistent feelings of sadness, hopelessness, or irritability. It's when you can lose interest in activities that you really used to enjoy, and you can have difficulty engaging in daily tasks. So sometimes this might even be something as simple as showering or brushing your teeth or putting on a clean pair of clothes. If you're struggling with depression, sometimes those things can seem really daunting and difficult. People who do struggle with depression, oftentimes there is a link to memory difficulties as well. So again, that's why it's really important if you are having any concerns with your memory to talk about that with your family doctor. It could be just a normal part of aging, it could be dementia, it could be depression, right? So there's all these different pieces that we have to consider. So that's why your family doctors are really good support, just to kind of help you figure out which piece you're really struggling with.
Just ask you a question. So, back when I learned about this, we used to differentiate between reactive depression, which might, for instance, follow the death of a loved one, and it is sort of a normal grieving response and generally resolves itself, as opposed to endogenous depression, which is more sort of deeply rooted. Is that still a differentiation that you make or not?
I would say very much so. There's situations that happen in everybody's life that it's completely normal to experience depression during those periods of time. And it doesn't mean that we treat them any differently. It just means that you may not need treatment for a long period of time. People have experiences in life where they may struggle more than other times. And we will get a little bit more into some of those types of situations going forward.
Good question.
But great question, thank you. Okay, so next we're just going to touch on anxiety. I just call it worry. I know lots of people say they don't have anxiety, they just worry about everything. It's kind of the same thing. So what is anxiety? Anxiety is a condition that causes you to feel fear, nervousness, or distress. When we talk about anxiety, lots of times there's a trigger for anxiety. Most of the time there's triggers. Sometimes we have to spend some time kind of evaluating what is making you, what is triggering your anxiety. And for people, it could be anything. It could be just having to go for a walk down the street. It could be having to get in your car and drive to the store. Or it could be something from your past experiences that is now causing you some anxiety later on in life. So there's really no right or wrong answer when it comes to why people are having anxiety. There's lots of things to help treat anxiety. We can use medications, but there's also lots of different types of therapies and stuff too, which we'll touch a little bit more going forward. This is the first time we've done this presentation, so bear with us.
Okay, so over the next few slides, we're just going to talk about potential causes for depression and anxiety. So why are you feeling this way? There can be many different reasons. These are some of the most common that we see. So a big one recently especially is the state of the world. Lots of times just turning on the news can cause that worry and that anxiety, so that's a big one that people are struggling with. Finances, I think, as well, right? I mean, do you feel prepared for retirement? Is that something that keeps you up at night? So that's a really big cause for worry as well. And then the last four we're going to get into a little bit more detail as we go on, but there's also things like loneliness and isolation, loss and grief, major life changes, and deteriorating physical health. So these are all some reasons why you might be experiencing depression and anxiety, but again, there's many reasons, right? And it's very different for everyone.
Okay, so we're going to touch just on loss and grief in this slide. So it almost seems like a negative kind of thing when we're saying loss of partners and friends and family, loss of independence. So it seems like as we age, we start experiencing more and more loss. When we say loss of independence, having to move out of your home that you've lived in for, maybe 30, 40, 50 years and raised your family, it would be understandable why that would cause some anxiety and depression. Lots of independence in the sense of mobility, not being able to get around as well, not being able to attend some of the things that you enjoy doing can cause feelings of sadness too. Loss of purpose. We feel like everybody needs to have a purpose to your day, and sometimes as we age, we lose that purpose maybe when we retire and stop working, and if we're not connected socially, people feel like they've lost their sense of purpose.
Just talking a little bit more about some of the changes that you can experience. Again, like Tracy mentioned, it could be something like having to move. Loss of license, that can be a big one. It kind of goes hand in hand with that loss of independence sometimes, right? You don't have the freedom or as easy access to go and do the things that you want to do. Caregiver responsibility and stress as well, right? That's a whole other role, and that's a lot of responsibility on one person, and of course it can affect your mood and how much you worry. We talk about major changes, but it doesn't have to be major. It could be something as simple as you're not able to plant your garden anymore, or you can't read as well as you used to, right? You're having trouble with your eyesight. So again, it's very individualized, and anything really any changes, minor, major, they can have an effect on your overall mental health and your mood and how much you worry about these things.
Okay, and then we'll just touch on deteriorating physical health. As we age, there always seems to be things that crop up. So, getting diagnosed with a chronic illness, maybe dementia, cardiac conditions, diabetes, arthritis, COPD is a breathing disorder. So those are some of the more common ones that we see that people struggle more with anxiety and depression. Pain management. Pain has a huge role to play in our mood and how well we cope with things. So having good pain management is very important. Loss of mobility, I touched on that before. If you're not getting around as well, it's very hard to maintain your independence and get out and do all the things that you want to do. Oh, and then just with the mobility piece, there's like taxis have wheelchair taxis, that kind of thing, but there's also access transit. So that is something that people can use or access and apply for if they're having trouble getting around mobility-wise.
So how do you adapt to all of these changes? Everyone responds differently, and understanding what's important to you and finding activities that are meaningful and worthwhile for you will hopefully help adapt to some of these changes. So that's what we're going to talk about next, is just different ways that can help you if you are experiencing low mood or anxiety.
Okay, so what can you do? So if you're struggling with dementia, anxiety, depression, any one of those things, here's a list of some things that we encourage people to do and we teach people. So maintaining a daily routine, and we'll go into these in more detail. Exercise regularly, eat a balanced diet, social engagement and groups, and prioritize sleep.
So maintaining a daily routine, there's many different ways you can do this. Waking up and going to bed at the same time every day is a good place to start. It just kind of gets you in the habit. Eating at regular times is another big thing. Sometimes we don't feel hungry, but we know we should eat, so just kind of getting into that routine. Taking medications at the same time each day. I mean, we all forget to take medications, that's just what happens, but if you get used to taking them at the same time each day, that's just one of the ways that can help you maintain that. Making sure you're getting regular exercise, We'll get into a little bit more about the exercise piece later on. And then minimizing napping, just, you know.
I hear some protest.
I like my naps too, so I get it. But, you know, minimizing napping and just trying to keep that routine so that, again, you can have the good sleep-wake cycle and have a good bedtime routine as well.
We'll talk a little bit more about napping in the sleep part. Okay, so exercise. We all know that we need to stay active. No matter how old you are, no matter what you have and don't have, it's important to stay active. And that can look different for everybody. It doesn't mean you need to be getting out and walking around the block or going to the gym or anything like that. There's lots of different ways to stay active. So we know that strength training and flexibility is a very important part of aging as it helps us maintain our muscle mass. So finding programs, things at home you can do. If you're a bit computer savvy, you can go online to YouTube and find things where you can, you know, work more muscle kinds of stuff. So there's lots of different things you can do. Resistance training, that's all part of that. And you can just do that stuff at home. You can do that sitting in a chair. You know, you don't have to be out walking and doing things. And also part of exercising is just maintaining a healthy weight. We know that weight is very much attached to mobility. So if you can manage your weight, usually we can get around a little bit easier. So yeah, there's lots of different things. There's, you know, if you live in an apartment building, you can walk the halls. You don't have to be like going outside. There's aquasize. I think we were talking about pools earlier, so there's options for that. Yeah, and there's chair exercises and chair yoga. So we did bring pamphlets and stuff from the health center for their in-motion programs. So we've got information up here if you're interested in any of the in-motion programs. There's pole walking, there's chair yoga, there's resistance training. There's phone numbers here. You guys can connect with them if you're interested in any of those programs.
The next thing that is also really important, not just for physical health, but for mental health as well, is just eating a balanced diet. So trying to make sure you're eating nutritious foods. Our lovely lunch was a beautiful example of that. Making sure you're drinking adequate fluids. So lots of times it's easy to forget to drink water throughout the day, but it is something very important to do. And, you know, fluids, coffee and tea and juice and things like that as well. Just making sure you're getting adequate fluids throughout the day. Making sure you're eating an adequate amount of food. And if you're not, to use calorie replacements. So things like Boost or Ensure are a really good way to make sure that you're getting your daily calorie requirements. And then eating enough fiber as well is all very important.
If you have access to the Canada Food Guide, it's actually the best guide for dietary food. I know there's lots of information out there about what you should be eating and not eating, but the Canada Food Guide is still one of the best resources for diet. Yeah. Okay, social engagement, which I love to see. I've been listening to everybody talk here, and everyone talks about the groups they're involved in and the volunteering and the activities. That is so, so important. So participating in social activities, get out and socialize, volunteering, staying connected with friends and family. We know that this will help seniors age better. It's a part of it. And yeah, join a group. We talked about the community hubs are great resources, your church groups. We've got information here about McCarricker. That is our mental health day program, and they run all kinds of not only social groups but also like education groups. So you guys can pick up those if you're interested in any of that. We've got the books from the Council on Aging here if you guys want some. If there isn't enough, you can get them at the clinic, but also this is available online. The whole book is online if you want. If there's not enough books, you're welcome to take what's there. What else? Okay, I think that's it. Okay.
Okay, now back to the napping topic a little bit. So just talking about prioritizing sleep. So having a bedtime routine, right? I think sleep hygiene is a big thing that we talk about. So it's just minimizing that screen time before you go to bed, trying to do more relaxing activities, whether that's just deep breathing techniques or meditating or, whatever it is that kind of winds your mind down and relaxes you a little bit. Minimizing stress, easier said than done, but again, just trying to engage in some activities that kind of slow your heart rate down. Deep breathing is something that we talk about all the time. Everyone has access to it, and it can be a really, really great thing for relaxation and in turn to help you sleep. Limiting caffeine before bed. I think the recommended timeline is no caffeine 6 hours before bed. And taking bedtime medication as prescribed. Another thing is, Tracy informed me of this the other day, warm milk is a thing. Tryptophan is in warm milk and it can act as a sedative sometimes, so that maybe is a little trick. If you have trouble sleeping, you can try some warm milk. But yeah, just prioritizing sleep, making sure you're getting enough of that. A few naps throughout the day is okay sometimes, but just wanting to make sure that you sleep good throughout the night.
Yeah, just touching on kind of bedtime routine, there's a thing that we call sleep hygiene. So that gets into a little bit more detail about your bedtime routine. So that can also mean like making sure your environment is conducive to sleep. So your bedroom is dark, it's cool or the right temperature. Some people like to have some background noise, so maybe a fan running, some of that what we call white noise. I mean, everybody's different in what they like, but making sure your bedding is clean and warm enough or cool enough. So there's lots of things that we look at when we talk about sleep hygiene. Is it quiet? Is there too much noise? Do you have your phone by your bed? Maybe that's something that you should take out of the room if sleep is a problem. I find that's kind of one of the big things that we as seniors struggle with. Yeah, I think that's, and you can go to the next one. I was going to say, I know lots of times we look for medication to sleep. Sleeping medications aren't always ideal, especially for seniors. They can cause dizziness, unsteady gait sometimes, like unsteady mobility. So if there's things we can do to promote sleep without having to use designated sleep medication, that's certainly something that we encourage people to, and work with people to try and use other things to help with sleep.
So these are some of the, so everything we just talked about is kind of non-medical treatments for if you're struggling with mood or anxiety, but there is medical treatments available. So there's things like different therapies, CBT and DBT. So that's cognitive behavioral therapy and dialectical behavioral therapy. In a nutshell, these therapies just focus on your thinking and trying to change your thinking patterns, and as well as teaching you different coping and relaxation techniques. So therapies can be very helpful. Support groups can be very helpful as well. Like we mentioned earlier, there's support groups like the Alzheimer's Society, whether you're the one experiencing memory troubles, or if you're a caregiver of someone who has dementia or Alzheimer's, support groups are a really great thing. And then, of course, there is medications as well. And again, that's why it's really good to be involved with your family doctor. Sometimes we need medications for a short time, sometimes we need them for a long time, but it is always an option.
Okay, I think that's just about it. So we put this here, how to connect. So we've got our cards here. So if anybody's feeling like you maybe you're having some mental health issues, you're struggling with something, you're welcome to reach out to us at the clinic. we've got our cards there. We're happy to do that. But like we've said a few times, your family doctor is your main person contact. And I realize that lots of people are struggling to find family doctors or have good family doctors. You don't need one to come to the clinic, especially if you want to access Brianna and I. You certainly don't need to have a family physician. Yeah, I think that's about it. You guys are welcome to, there's a little pamphlet here or a sheet on just some of the things we talked about in regards to mental health. I guess, does anybody have any questions? That's kind of most of our presentation, but yeah.
Can you talk about sundowner syndrome?
Sundown. Okay, so sundowning is what happens when somebody has dementia. So we didn't go into great detail about dementia. So there's Alzheimer's, there's 3 or 4 different kinds of dementias, which is like Alzheimer's disease, and then there's Lewy bodies, there's, I have to pull it out of my brain. Anyways, there's 3 or 4 different kinds. So when people have dementia, sometimes they will experience something called sundowning. So it's when they become more agitated or restless later on in the day. So this is something that Brianna and I get consulted to see people quite regularly, actually. When I'm done here, that's where I'm off to, is to actually go deal with this exact situation. So it can be very difficult to treat. We use medications depending on how severe the sundowning is. And lots of times sundowning can include people's increase in wandering around. If they're in a facility, they'll start to wander, they'll be more restless. They may be looking for somebody, they may be looking for something. And lots of times it has to do with people's past experiences in their lives. They've worked all day, maybe they're in their minds, they're coming home and it's time to get supper ready and I need to get these things done. Like they have a purpose. They're looking for something. So we try and use non-pharmacological strategies to help with this. So that's non-medications. But sometimes we do have to use medications to try and, I was going to say slow down the behaviors. Medications aren't always super helpful with people that are experiencing sundowners. Lots of times just a trial and error process. There's really nothing you can do for the patient to try and change what's happening to them. Hopefully sometimes medications can help. Maybe sometimes we use antidepressants or anti-anxiety medications because what that person may be feeling is causing them some anxiety and some restlessness. So we have seen some benefit with using anti-anxiety or antidepressant medications sometimes. There's no perfect solution for somebody that's experiencing sundowners. It does affect sleep as well. Sometimes that will go into the night and then they'll be awake all night. And we really have to assess kind of what's going on all day. Are these clients sleeping more during the day and then waking up at 3 or 4 in the afternoon and then awake all night? I don't know, hopefully that answered your questions. But it's very much can be a part of dementia. Not everybody gets it, but it's certainly not uncommon.
Is that what causes sleeplessness?
Does it cause sleeplessness? Sundowners? No, sundowning is only going to happen in the population that has been diagnosed with dementia. So the average person doesn't have that. Yeah. There can be many reasons why you don't sleep at night. Lots of different reasons. I don't know. I guess you'd have, and that's what we talk about, like looking at sleep hygiene, looking at kind of what you're doing throughout the day. And as we age, we do need less sleep. It's kind of a thing, but yeah.
So I just want to offer a couple of things that have been helpful in my experience.
Absolutely, please.
My wife died about 10 months ago now, and we used to just talk continuously all the time, and the silence becomes quite oppressive.
Yes.
And so I do spend a fair bit of time online, and it's quite interesting how some social media channels, like I use Twitter, actually enable you to connect with people in a way that's quite positive. I mean, you may never have met them physically in life, but you exchange ideas and you
Absolutely.
interact with each other, and so that concept of engaging with people electronically is something
Yes.
that wasn't available many years ago, but it's now very available. The other thing I just want to mention, you mentioned about having sort of rituals or things to to sort of look forward to in each day. And I have my little 3 o'clock 1 ounce of scotch.
Hey, whatever floats your boat.
Yeah, and it's really quite interesting. I mean, I don't drink any more than that, but I like scotch. And it's so interesting how, rather than your day just sort of being totally unstructured, you sort of anticipate, oh, it's getting close, to 3 o'clock, and I'll have my little moment of liquid joy.
Yeah, and that's where routine is important.
Yes.
It's important to try and maintain that routine as much as you want. Connecting online is great. I heard as another lady talking about an online program that she did. If you have access to a computer and you're comfortable using, absolutely there's lots and lots of different, even anxiety management, depression, lots of different things you can access online to help. Grief, there are, I didn't bring pamphlets, but the Health Authority does have a grief, loss and grief group. I didn't think of bringing that, but that is a thing. And if there's something you're needing that we haven't been able to provide today, please stop at the clinic. We can find whatever you need. There's lots of, SHA does have a lot of supports that we can get you connected with if that's what you're needing. And sometimes that's all we do, is people come in and we just connect you to other resources and off you go, kind of thing. Yeah, thank you.
I'd like to know how you feel about melatonin use. I look at the bottle and it says, okay, take it to half an hour so you get drowsy, and then you can sleep. I don't know which night I don't sleep. I go to bed, I'm out, and it's 3 o'clock in the morning. Hello? Everybody out here.
Lots of people use it. So if anybody that doesn't know, melatonin is an over-the-counter, you would find it in the herbal section. So our bodies naturally produce melatonin, so it's not like you're taking something that your body's, that's foreign to your body. We produce melatonin as the sun starts to go down, to tell your body that it's time to start getting ready to go to sleep. So taking melatonin can be helpful for some people, and I have had other clients that say, this didn't do anything for me. It's really a trial and error. If you try it and it works, great. I don't think there's any negative effects from taking it, but it all depends. Everybody's different if that is going to be helpful or not. Do you have anything else to add? Yeah. I mean, it's not a bad thing. If it works for you, great. If it doesn't, I was always told you take it a little bit longer than a half an hour. Try like an hour, hour and a half before, so it just has that time to kind of reset. It all goes with your circadian rhythm, which is the rhythm of getting up in the morning when the sun comes up and your body getting ready to go to sleep when the sun goes down. It kind of works with that. It's something shift workers tend to use a lot. But it's worth a try before you go to having to get a prescribed medication. It's worth a shot, for sure. Yeah.
Is dementia or Lewy bodies disease, which one is harder to diagnose?
There's certain...
Sorry, can you repeat the question so we can, yeah.
She was just asking about which is harder to diagnose, like an Alzheimer's type dementia or like a Lewy bodies type dementia. There is specific criteria for each one. Treatment is generally the same for most of them. I almost would have to direct you to a doctor. You're doing a course right now. Do you remember talking about some of that? Specifics, yeah. I wouldn't be able to say specifically which one would be harder to diagnose. They progress differently. Lewy bodies tends to progress faster. I mean, this is something, if you guys are interested in more information about this, something like this, we're happy to come back. If you want us to come back, we're happy to come back and talk more specifically about things. I used to teach an anxiety management course for seniors as well, so we could talk way more about anxiety, or if you want more information about dementia, we could go into much more detail if that's something that you guys are interested in, but I gotta do my research and have my slides and everything. So sorry, I'm not exactly sure, like, when diagnosing, there's lots of different things that they look at, so it would be like a physician that would have to probably and some of these things are actually diagnosed by geriatricians, which is a geriatric specialist, and it is under the psychiatry umbrella, so even sometimes geriatric psychiatrists will get involved in diagnosing some of these things, because some of them can be a little bit more complex, for sure. Any more questions? Okay, well, thank you very much for having us. Like I said, you're welcome to come to the clinic. If you guys need anything, just pop in. We're not always there because we do home visits with clients in this Newtown suburban area. But leave your name and phone number and we're happy to connect with you. Okay.
I was just gonna ask you if we have to make an appointment to meet with you at the clinic, that might be better.
You just call us and we'll
Okay.
book an appointment with
Good.
you. Yeah.
Good.
The nursing, the MOAs, the receptionists don't do any of our booking. We do that all
Okay.
ourselves. Yeah.
Okay. Thank you very much. It was very informative. You've given us a lot of options, and we may just have you back sometime.
Yeah,
Thank
not
you
a
very
problem.
much. Thank you.